Dr. Gregory Schmidt is a critical care specialist affiliated with University of Iowa hospitals and clinics. Doctor, thanks so much for being with us. I saw you quoted as saying people in leadership are starting to say things in meetings like, I have a sense of impending doom. I mean, it's chilling to hear that. Explain.
Well, these are unprecedented times for us, and we see the numbers, we see the trends, and we know that roughly 2 weeks after infections, patients will be in the ICU. And so we can see our future before us, and we're doing everything that we possibly can to get ready, but we know that this is an unprecedented surge, and we're going to really have stressed systems.
You are truly front line. Give us a sense, because I don't think most people have a clue, give us a sense of what it is like in the ER as beds fill up, and you're looking patients in the eye. It all seems a bit anonymous to most people, I think.
Well, this is a profound illness. Patients become desperately sick, critically ill, unable to breathe, often requiring artificial machines to breathe, sometimes even artificial lungs to replace their failing lungs. So they're desperately ill, and they are separated from their usual support systems. And that's one of the things that's particularly unusual about this disease, is that because we're in a pandemic, families are not there, which means these patients are on their own. That's hard on them, and it's hard on us.
Well, exactly. And I was going to get to that in a moment, but you are dealing with sick and dying COVID patients, and then you and the people you work with perhaps leave and see bars that are packed, people in restaurants, people partying. They're watching the football or whatever. What goes through your minds and the minds of your colleagues when you walk outside the ER and you see that behaviour?
Well, Michael, frankly, we're concerned. It's some of my colleagues are angry. They're scared about what's going to happen, and maybe the best word would be frustrated. Frustrated because the devastation that is in front of us now and worsening in the next few weeks is preventable. At least to a substantial degree is preventable if we took the proper steps. And so it's seeing those people at bars, that's not the proper steps, and that's not going to ameliorate this pandemic.
You touched on this, and I do want to revisit it. You speak about the toll on staff. It has been non-stop, months on end. That cannot go on forever. What sort of mental toll is it taking on medical staff?
Well, Michael, on the one hand, we're professionals, and we're doing our job. And we will do our job. But when every day you are up to your elbows in critical illness that keeps coming, one of the challenges about this is that we're kind of mopping up the damage of a virus, and we can do that, but somehow the spigot has got to be turned off, and this illness needs to be controlled. And those are things that are beyond the power of any one hospital or any one specialty group. This is something that is going to require national action on the part of our leaders and on the part of our population.
Right.
We need them to join with us in this fight.
I was just about to ask you about that. What is your message to those showing COVID mitigation fatigue, if we can call it that? I saw a tweet. There was a brand new member of Congress who tweeted yesterday, masks are oppressive, my body, my choice. What do you say to people who continue to push back on coronavirus restrictions, the whole freedom argument?
Well, I think freedom is not really the right term. There are many things that we're not free to do because we live in a civilized society. We can't drive down the wrong side of the street. We can't go downtown with our pants off. These are things that in a civilized world you don't do. But I think I actually want to defend the citizens in a sense because they've gotten conflicted messages. And I think one of the things that the coming administration needs to do is to be more on point with messaging, a consistent message to the population about what is going to be required to get this under control. Because a vaccine is going to help, but it's going to be a while before a vaccine is going to have its effect, and hundreds of thousands of Americans are going to die before that happens.
Absolutely. A pleasure to speak with you, Dr. Gregory Schmidt. We appreciate your expertise. We appreciate what you and your colleagues are doing every single day that people, I think, by and large, aren't getting at the moment, and it's important. Thank you.
My pleasure, Michael. Thank you.